Throngs of angry protesters from around the country barging in on the Senate Finance Committee hearing on Graham Cassidy. That, of course, is the revised American health care plan bill that the Senate is hoping to get passed, voicing their opposition to the GOP health care bill. And it could come up for a vote any day now. I believe the deadline is Saturday if they want for it to pass by 51 votes. The bill was hastily revised over the weekend to direct more money to states where senators are a little intransigent and a lot intransigent. Alaska, Arizona, John McCain, Kentucky, Rand Paul, Maine, Susan Collins. These, of course, are states where senators have said they're either wavering to the no side or they will not vote in favor of the bill, or they're just saying they're undecided at the moment. All of this as the Senate careens toward yet Saturday, the September 30th deadline to repeal and replace Obamacare. Republican Congressman from Georgia, Drew Ferguson, is a dentist and a member of the GOP Doctors Caucus. And, sir, thank you so much for joining us. With your practiced both political and medical eye, does this thing have a pulse in the Senate, or has it already flatlined?
No, I think it does have a pulse, and I think it's important the Senate keep working on it and get the House a bill. We have already passed a bill in the House. We've shown a willingness to continue to push forward on this issue. And what the senators know is what I know is that my constituents back home are hurting under Obamacare, and we have got to do something, get them some relief, and let's fix our health care system.
Well, you voted yes on the original American Health Care Act, correct?
That is correct.
Now, it protected people with pre-existing conditions. Graham Cassidy, as we understand it, allows for states to increase premiums for people with pre-existing conditions. And while supporters argue that states can get a waiver from Obamacare protections like pre-existing conditions, it'll be fine as long as the states promise, and I quote, adequate and affordable coverage. Here's the problem, Representative. It isn't specifically articulated what adequate and affordable coverage is. And that was the exact point that Fox News' Chris Wallace pressed Mark Short, the Director of Legislative Affairs, about that issue. Let's listen to this, and then you can comment.
Adequate and affordable coverage will be guaranteed to every one of those states that apply.
But what's the definition of adequate and affordable, and what does it mean when a state can raise premiums?
That is a separate question. And do you want Washington, D.C. dictating across the country what those rates are for everybody, regardless of conditions?
What good is insurance coverage if you can't afford to buy it?
So, Congressman, do you have any idea what the bill's definition of adequate and affordable is?
Well, we're waiting to see what the final bill coming from the Senate is. But I can tell you this. I think the end of the question right there in the interview where they said, what good is coverage if you can't afford it, is exactly what we're saying about the Affordable Care Act right now. We have premiums that are through the roof, deductibles that are really out of reach for the average American family, and so we have got to move in a different direction. And I think that any time that we can return power to the states and the decision making closer to the people, it's a good day for America.
You know, you are so right. I have a very close friend who is a freelancer in Chicago. And she already can't afford it, but in a couple of months, some trigger is going to be pulled. And she said, I will not be able to afford coverage. So it absolutely has to be fixed. But if it were to pass in the Senate as is, and it must come back to the House for a vote, as it stands, would you give it a yay or a nay when there's this squishy area about what really is covered as far as pre-existing conditions are concerned? Because just about everybody I know who's an adult has something like that.
Well, let me say this. I stand by what we said originally, and that we want to make sure that every American has access to affordable coverage. I certainly haven't seen the final draft of the bill as they're still working on it, and we're going to wait. We're going to wait to see that. But we're going to do everything that we can to do our part to push this bill across the finish line, because what we have right now is simply not working. It's unaffordable. It's a broken system, and it's not only hurting patients. It's destroying our entire health care system. You know, at the beginning of your interview, you asked about me being a health care provider. I will tell you that this is going to continue to drive providers out of the medical community, and we're going to exacerbate the problem of access to care. So we've got to do something, and I believe that this is a step in the right direction. I also think it's important to remember that we as Congress should not expect to take one single vote and the health care debate to be over. This is the first step in what will be a long process of rebuilding our health care system and moving away from the Affordable Care Act.
Before we go, as health care stumbles and tries to find its way, do you have belief that the tax reform plan can pass, signed, sealed, and delivered as promised by the end of this year?
I do. I'm excited about the possibilities. I'm excited about a plan that is much more simple, that's much more fair. It removes the loopholes and the unfairness in the tax system. It lowers rates on every single American. That's what we're fighting for. And I believe that it will happen because this nation is hungry for job growth. Americans want good-paying jobs. We know that if we do our homework, we get this right, we are going to have success as a nation economically, and that is vitally important because we have a $20 trillion debt, and we have got to pay that down.
And floss, always floss, right, dentist? Right.
Absolutely, right. Yes.
I know. I'm a little obsessive about flossing now.
Hey, that's a good thing.
You. Keep us posted. Congressman Drew Ferguson, thank you so much.